We are really excited to have you here with us, and congratulations to students who have been admitted early decision. We are really excited that you are going to be joining us next fall, and we're really excited to introduce you to these two fabulous faculty members. We are joined here this evening by Karla Erickson, who is a professor of sociology, and Eric Ohrn, who is an associate professor of economics. And we're really excited to launch this session this evening. It's the first one like this that we've tried, but what we really wanted is to give to all of you admitted students a chance to interact with our professors and also to see how they interact with each other. One of the great joys of living in and being a part of this academic community is how people are with each other and how they learn from each other and how they talk to each other about issues of grave importance. And there is nothing more important that we could think about than to invite Karla and Eric to speak with us a little bit about, how do we recover from COVID-19, and how does a sociologist think about that, and how does an economist think about that, and how do they talk about it with each other? So I will turn this over to Karla and Eric for some introductions and then to kick us off. Thank you all for being with us.
Well, hi, everybody. Good afternoon. Good evening. Thanks very much to Tina and Rachel for inviting us. And Eric, thanks for agreeing to be my conversation partner in this. And we really look forward to interacting with you. Eric and I have the plan to kind of do our introductions and our opening comments, each taking a short turn on that. And then we'll respond to each other, ask each other a couple questions, and then at least half the time leave open to hear from you and interact with you. So we hope that you like the main reading that we picked. Eric and I had a lot of fun planning this event because everything is changing so quickly that we had to keep updating the reading that we wanted to share with you. But I think it's a worthy topic, obviously, of some interdisciplinary discussion. So I'll say a little bit about me and a little bit about sociology and thinking about the pandemic. I teach courses called Work in the New Economy, a course on the social construction of sexuality. I'm teaching a course this term called I, Robot, which is about machine-human relationships, and a bunch of other classes in sociology. It's been a really good year to be a sociologist. It hasn't been a great year to be a human for a lot of people, but it's been a really good year to be a sociologist because we have some tools that are very useful for thinking about our time. So I just wanted to talk a little bit about that. I would say that the major lesson of the intersecting pandemics that we're living through right now is about the accumulation of privilege and disadvantage. And so as sociologists, we kind of cultivate our minds to recognize those interlocking forces. And so some of the ways that we can think about this in the pandemic is to really think about the pandemic as a social problem. And it's a little bit too big to just be a social problem. And instead, the pandemic feeds off of previous social problems like food scarcity, uneven educational resources, gutted public services, things like that. The pandemic logically followed, even though it looks illogical, but logically followed those kind of vulnerabilities in our social systems. So it feeds on some social problems, but then it produces new social problems. And so some of those new social problems are things like direction and authority, like who's in charge here, right? And so when the federal government didn't seize control in the United States, it was left to small governments, many of which have, the public health department of Iowa doesn't even have very many staff. And they've been trying to make decisions about regulations for safety and now about the vaccine rollout with very under-resourced offices. You also see the power of kind of stories about nations and who belongs to nations and migration and travel and who's entitled to what really motivate how both governments and individuals navigate the pandemic, especially in nations like the US, where we didn't have a very organized approach to it. So story making and sense making have been really pivotal too. And because sociologists are interested in collective activity, right? We're not an individual discipline. We're interested in social patterns and in interactions. We have a lot to contribute to thinking about how to unravel the social problems of this time and to use previous social problems to help us understand these. So for example, Eric and I were talking, I was trained in graduate school at a time when we were still really digesting the AIDS pandemic and really thinking about AIDS. And so some of that applies really directly to our present moment and others don't. And we, of course, we see that in the news, the way historians of 1918 have informed, 1912 have informed this period as well. So in terms of those, layered, accumulated advantages and disadvantages, we can think about all kinds of things like faith, community, trust in medical systems, right? Feeling like you have access to authority, feeling heard, having your pain taken seriously. That's what I mean, not just kind of monetary inequalities, but also those other more symbolic, but also very consequential ways of understanding our world. So I liked some parts of the reading that we picked out, and I'll have questions for Eric. I want to know what's on his mind, but I think the notion, I think it was Ngozi Ezike who said that these vaccines are precious and scarce right now. And she gives, for example, that one data point that says maybe this range, right, this mortality range that we've assumed, like what constitutes an elder, is actually a white standard of an elder, because average life expectancies are so shaped by race in this country. So I think that was a good example, a very concrete and a very deadly kind of example of how not just authority and direction, but also even the very measures we use are touched by social aspects like race and class and gender. So one of the things that, as a sociologist, but also as just a citizen, I've been really struck by is how little the consequence to children has been really factored in, so there's a lot of competing about public health or business, right? Like, what's more important, what's the greater risk, but we won't know the real cost to children of this pandemic for a very long time. And so those are some of, having watched how sociological understandings of the AIDS crisis unfolded over time, many people will be taken up in those kinds of questions about even how our trust in our own family units has both deepened and become very fragile during this time. So it's a good time to be a sociologist because we have some tools to help navigate a thing that we had to navigate anyway, but it has at many times been a devastating year to be a human, not only because of the pandemic, obviously, but that's part of what we're talking about tonight. So with that, I'll hand things over to you, Eric, to see what's on your mind.
Thanks so much, Karla. It's really fun to be here with all you guys. I guess I'm trying to reflect back to what it was like when I was admitted to Grinnell, because I'm actually a Grinnell graduate. I graduated in 2007. And the kind of funny thing, and maybe why we're paired up on this Zoom call together here with all you guys, is that I actually had Karla as a Professor Erickson to me and Professor Erickson to all of you guys. But yeah, I was lucky enough to have a class with Karla, and it was a class in sociology, obviously. I took 2 sociology classes at Grinnell, and I loved my sociology classes, right? Because they taught me kind of about societal problems. And the funny thing is that economics and sociology are really similar in that we both want to solve the same problems. We just kind of have a different tool set and a different language with which we go about and think about that, right? So I wanted to share a little bit about like how economists think about like recovering from COVID and vaccine distribution here in this area, and then Karla and I will have a little bit of a back and forth there. I do want to just say that I guess this is my 7th year at Grinnell now, and I study mostly things about corporate tax policy, but we were kind of paired together a little bit happenstance because we had this really fun relationship, but also we work on similar things. So Karla has this iRobot project going on, and I actually study the effects of tax policies that induce businesses to do more capital investment. Well, capital investment nowadays is a lot of times robots, right? So I really want to look at how those capital investments affect labor markets. So how do they affect wages? How do they affect employment? And these are questions that are really important as we, think about kind of the world recovering from COVID and how do we go, back to normal? How do we increase production in the future? But I'll pause here for a second just to, talk a little bit about how economists think about recovery, how they think about vaccine distribution, et cetera. And again, one thing that I love this session, I'm so glad the admissions department put this on, because one thing that I see when I advise students coming in is that they only take classes they took in high school, right? They take math and they take Spanish and they take, whatever classes they had before, but there are so many more options at college that you might not have had before. So I'm super excited that you guys get a little bit of exposure to the social sciences here. And hopefully you guys can take advantage of this in the sciences and in the arts as well. So I will, share a couple of thoughts here. Okay, so the first thing is that when economists think about COVID vaccines and even just like, how are we going to make it to, to the time when we get the vaccines over the next couple of months, we think about this thing called negative externalities, right? So the problem here is that I am engaging in behaviors that, and like the amount of, safe behaviors I'm engaging in are like just enough to get me not sick, kind of like, I'm like kind of like weighing like the pros and cons of should I wear a mask? And the only pros I'm thinking about are myself, right? I'm only thinking about like, I just don't want to get sick. But here's the thing, if I get sick, then I'm more likely to get, many other people sick. And so the idea here is that we actually, because of these negative externalities that people don't think about, we actually have a market failure, right? And so this is the exact type of place where economists want to step in, and we want to kind of fix markets. And we talk about the world just as markets. So we just say markets, that doesn't really mean much, right? And so thankfully, we actually kind of have the solution out there, right? We actually have this vaccine, okay? Now here's kind of a perverse thing. Economists love these perverse backwards things, okay? Imagine two people. One person has been really cautious for the entire, last 9 months. That's me. I've been really cautious. Okay. I've been holed up in my house. I've been wearing a mask. I've been, limiting trips to the grocery stores. Right. And then imagine somebody else who doesn't believe in masks. Who deserves to get the vaccine first? Well, there's this idea of deserve, right? But what economists would say, we should absolutely give this vaccine first to the person who is going to go out there and potentially spread it to many other people, right? Now, we do see this at play in a much more like, that's kind of fraught with this like, moral judgment, right? Is that I've been good and somebody else has been bad. But first off, who's in this like group 1A? Well, it's doctors, right? Because they're going to engage with people. They could get themselves sick. They get other people sick. So we really think that those are the people which have the biggest, negative externalities potentially, right? Because if they get other, sick people sick who are sick with other things, like sick with COVID, that's a really big problem, right? And of course, they themselves need to operate. We need them to help other people back to health. So certainly they should be like the first to get the vaccine, right? So just thinking about, I think externalities here is one way that economists kind of see the world differently than other people. And I will just say, I think economists are really nice people because they're always thinking about the externalities that they impose on others, right? And so that's my plug. Economists really are nice people. Here's the second thing I'll say. So I said markets, right? Well, here's an actual market we could be talking about, right? It could be that the US government just, allows people to buy the vaccine. Whoever is willing to bid the most, well, they get the vaccine first, okay? And we've decided that this is definitely not okay in the United States, right? We actually want to give it to, high-risk people. We want a really, nice, clean system. Hey, in reality, that's not actually happening. But imagine that we were actually getting that, right? So we've decided we're not going to have markets. We're not going to have the person who is willing or able to pay the most get the vaccine. And we're kind of saying, okay, good, we're doing the morally right thing. Well, guess what? The US itself purchased the vaccine from these companies. And so everybody in the United States is in line ahead of everybody else in countries that weren't able to purchase the vaccine or chose not to purchase the vaccine, right? So this idea that in the United States right now, because we're sitting in line and doing the right thing, that it's morally appropriate, is not really true, right? The United States and other developed nations are getting ahead of other places in the world. And so this kind of suggests that if we don't think that we should be allocating vaccine, according to dollar signs and who's willing to pay here, then we maybe shouldn't be doing it in the whole world at all. And maybe the big governments in the world should have purchased the vaccine, should be producing it, and should be distributing it around the world according to the categories that we're suggesting here, or that are being used and in place, right? So that's just an interesting take, right? It's like we think, maybe, I don't know. I know people here are from spanning the globe right now, and so maybe like your country has purchased no vaccines, right? Or not yet, right? Australia hasn't purchased any vaccines, or they haven't approved any vaccines yet. So that's kind of interesting. Now let's kind of get these two things together. We have all of these, rules in place. We're going to give out vaccines. People are going to take vaccines. Then people aren't going to get sick. Well, some people aren't going to take these vaccines, right? People are going to say, no way, I don't like this. They're quote unquote anti-vaxxers, right? They've been swayed by non-science over the past X number of years in disinformation campaigns. And so they are going to decide not to take this thing. Well, economists actually do have a great solution for this one, and I wish we had been using it. We should pay people. We should pay people to take that vaccine, right? And you know what? It's not like we're not paying people right now. There are stimulus checks that have gone out, are going out again, and we're debating more stimulus checks in the United States and in countries around the world. There's UI benefits and or unemployment benefits going out to places around the world. Why not pay people? Why not create an incentive for people to take the vaccine? The faster we can get full buy-in to that 80%, the faster we can solve this. And I think that this all kind of, goes back to one more simple point. Economists do love saying this all the time. Money does, well, we don't say this, but I'll tell you that money does not grow on trees. It's not free. We can't just keep printing money. But right now is a great time to spend money, and we should be spending more of it to either get people to take the vaccines and to buy more vaccines. The United States and countries throughout the world made huge mistakes in not pre-purchasing more vaccines, and because there's just tons of economic activity on the table. Early on, at least in the United States, there was this discussion about this trade-off between, the economy and, the economy and like lockdown and non-pharmaceutical interventions, right? And it's a false dichotomy though. If you want a thriving economy, guess what you need to do? You need to get everybody healthy again, okay? So I guess those are kind of like my big thoughts from an econ perspective on recovery from COVID and vaccine distribution, and whether or not these tiers they're the right thing to do, but they should be maybe the right thing to do throughout the entire world too. So maybe at this point I could maybe ask Karla a couple questions, and then Karla can maybe ask me a couple questions, and maybe that will prime the pump for some of you guys to ask questions. And I think we're going to ask questions in two ways. You're welcome to, number one, type into the chat. We've got a chat here, questions, and then Tina or Grinnell College Admissions, which is Rachel Arsenal, can go ahead and moderate those and ask them to us. Or you're welcome to raise your hand, and Karla and I will call on you as we would during a normal like Zoom class. And so Karla, let me start with a couple questions for you. One thing that you hit on a little bit is like kind of like, but I want to ask you more about is a sense of fairness. What do sociologists have to say about a sense of fairness? And what happens when a society kind of loses that sense of fairness? Because what I'm seeing right now is that people in my immediate family are, getting in line for vaccines. Some of them are, depending on what health system they're in, are getting it when they're are eligible when they're over 85 or over 65. In Minnesota, where I'm hanging out right now, there are health systems that are like giving the shots to construction workers. And so when this vaccination further frays our idea of fairness, like what can we expect and how can maybe we repair that?
Yeah, thanks so much, Eric. I mean, I love your focus on kind of, these are the verbs I've been thinking about is reopening, recovering, reaping. And, we're really seeing how much, like, not only did the virus kind of climb the vines of inequality, but then all that work of like trying to get the vaccine out, which is a dramatic proposal, right? To get this many people vaccinated, especially with the double dose vaccines, how much things like stigma and trust come in. So I think part of what I liked about this article that you and I decided on was that they were really talking about different ways of considering fairness, right? And so like you said, I mean, are we talking about saving lives or are we talking about saving years, right? Those are two really different notions of fairness. And then you and I had talked about as the vaccine isn't just a theory, but is actually being put into people's arms, the materiality of that, right? Of the kind of right to be safe, which we've been seeing throughout this pandemic, right? Is the, white collar workers and their protections and all of that versus frontline providers who tend to be, more working class, more underrepresented racially, have been at different levels of risk. And so having experienced the accumulation of all that, right? Like growing up in a medical system that really recognizes you and that you have easy access to, and you feel like your doctors really address your problems. And then you've also had the right to be safe. And now you're just going to go get this vaccine and be like a good citizen or whatever. Like that's one experience of that, right? And if the other is that you were in like a high density death area due to the virus, you've lost a lot of family members or friends, you don't really trust the medical system anyway. That the medical system has misappropriately used your ancestors. All of those things start to accumulate around issues of like trust and stigma. And even like you said, Eric, like the question of like, should I get it first because I've done a good job? Like there's all this kind of judging of each other and how we've navigated, a pandemic. And then if that person that you think made really bad choices during the pandemic gets the vaccine before you, that's a microcosm of some of these issues of like judgment, deservedness, and just like faith and trust in social institutions, including the medical community. One of the things I was really struck by, but I told you this, Eric, was a friend, her mom is a nurse in a hospital in Cleveland, and the one hospital in Cleveland, like almost 100% compliance, all the medical workers got the vaccine, and then just 5 miles down the road, so demographically very similar hospital, only about half of the medical workers were willing to get it. So when we talk about this kind of navigating of the virus, I'm talking about sense making, which is harder when you don't have more people around you. We make sense of our social world collectively, and we've been living in isolated ways. And I am talking about notions of fairness that develop through family and faith, but even through organizational culture. So that's why I'm talking about those two hospitals, because here are these two groups of seemingly really similar workers, and they probably have similar demographic profiles, and they went different ways with this, and that in part may be because we have some fatigue around decision making, and just we're seeing a lot of effects of exhaustion on our minds, of having to deal with novel environments now for as much as 11 months, depending where we live. So I would say notions of fairness are always really difficult to apprehend, and even more so now, given what the last 11 months have looked like, almost 11 months now, for us socially and interactionally. It's a great question. I love the question. Can I turn it back to you, or do you not?
You're welcome to. I just kind of wanted to ask like a little bit of a follow-up, if I might. I mean, so I love how you answer the questions, because I'm thinking, right, and admittedly, right, even after reading reading this article that's talked about these trade-offs, should we be targeting it by race and other things, right? I'm kind of just thinking like, okay, we're all in line, here's 1A, 1B, but you're saying, and I really appreciate this, that people who have kind of got the wrong side of the entire last 4 years, right, through through speech patterns of leaders in the government, and through where COVID has hit the hardest, et cetera, right, are also potentially places that are less likely now to have the type of trust that we need them to have, because those are the places where the negative externalities are potentially very large, right? Those are the type of places where it's much harder for these people who are disproportionately frontline workers, who can't go on Zoom and who can't socially distance. And so I see that, like we're seeing like over, years of trust erosion is maybe going to stop our ability to, vaccinate people. And then I guess, you and I had talked about this, and my concern is that, trust, as you mentioned, trust is organizational, it's communal, right? It's our communal sense making. And if we can't see each other and talk to each other face to face, especially among communities that don't have access to, really great internet connections and stuff like that, how can we expect them to, together decide that, yeah, we want to be the communities that are 100% protected and vaccinated, and now are trusting of an institution in which we didn't have trust before?
Absolutely, right? Yeah. I mean, fairness is just, it would be great actually to do an interdisciplinary course on fairness, like right now, right? Like that would be one possible thread to pull out of COVID, I think, is just notions of fairness. And then I think notions of fatigue. I think there's been a lot, there's been kind of market fatigue, there's been leadership fatigue, there's been truly like, capacity, mental fatigue, because evolutionarily we weren't very ready for this. We amped up our relationship to machines, and that's caused, eye problems and posture problems and, all that, even for those of us who have had the right to be safe. So one of my questions for you then, Eric, is really thinking about, I loved how you gave some examples of how economic thinking, could be factored in here more. And I think you and I probably have that in common, that we want like what our discipline provides to be considered, right? We want it to be worked into these complicated decisions. I think that came across in both of ours. So there's certainly been an underutilization of both economic and sociological thinking. There's also been effective use of those two disciplines in the last year, but there could always be more from my vantage point. So I'm just wondering if you were kind of, we got to hear these really smart people from different backgrounds, professional backgrounds, talk about what they want to see considered. And so what if you, Eric Ohrn, not just any economist, but you were like named to the committee? How do you think, what influence would you want to have by being in the room? Like, what would you want people to think about who was in what tier and how the vaccine got rolled out?
So let me say one thing is that is kind of a funny thing about economists is economists are very careful to make like value judgments, right? So what we really like to do is you tell us your values and we tell you the right policy to achieve the optimization of your values, right? So, the idea of whether or not we want to target like lives saved or years of life is really interesting, right? We want to target lives saved, and we really want to target this vaccine in like an older population, right? And then we can, economists who have, kind of been working with epidemiologists over the last, 9 months, right, could think about, okay, so who do we want to get, number one, right? But if we want to target, years of life, right? I think this is the situation where we really want to go into communities, right, that have certain socioeconomic and demographic characteristics, right? And so the optimal policy in those two different areas is completely different, right? And honestly, this is where we need a political scientist here, right? Is that, I think that we should be targeting, based on race in handing out vaccines. I think it is politically unfeasible, infeasible rather, excuse me. I just think there's no way that that's going to happen in the United States with a divided, government, right? Actually, I mean, it's unified now, but it's pretty close. And so, this is a frustration I think the economists feel all the time. I can tell you the optimal policy, but you won't actually follow it. Let me bend and change, shift gears a little bit. One thing that I've mentioned a little bit are like, checks that are going out, stimulus checks to try to keep kind of the economy alive as we, recover from COVID-19, not just with shots, but in so many different ways, right? And, one thing that we can do is look at, economists love looking at the past, right? And so what happened when we gave the first round of stimulus checks out, right? So we saw that spending for people who were lower income people skyrocketed the minute they got those checks, right? And they spent almost 100% of the checks within, a couple of months, right? And so that to me says that those people really needed that money, right? They were living hand to mouth. They absolutely needed it. Whereas when we sent those same checks in the same amount to people who were in the 75th percentile and above in the income distribution, we didn't see any movement. And in fact, we actually have just seen the bank accounts, right, go up more and more of the people who are wealthy. And we actually are seeing employment gains by people who are college educated in the United States, right? And so we're actually seeing a huge economic disparity in this. And I think that there's a great example, Opportunity Insights, which is a research group run out of Harvard and Brown, is doing really cool, like up-to-the-minute work on this. And they said that the place that's being hit the most interestingly by COVID is Midtown Manhattan, where both average incomes have gone up the most during the pandemic, and average unemployment has gone also up the most. So tons of people are losing their service sector jobs, but also the incomes of the highest earning people have just skyrocketed, right? And they're buying, washing machines and redoing their houses and stuff, right, like that. And so, yeah, I think, the recovery here then, right, isn't just about vaccines. It's also about thinking about, what are federal policies that are going to at least get us back to the level of inequality that we were seeing potentially before the pandemic started, right? And how do we, fix those rifts? So yeah, I mean, I think that's kind of like where I would like to see a lot of targeting going on, and that's, I guess, the question that I might answer. I think we are starting to see some things in the chat, and I could ask some more questions to you, but at this point, maybe we should just open it up and make sure we get some more questions from these potential future Grinnellians, or in many cases, future Grinnellians.
Yes, thank you so much to the two of you. Rachel and I were texting a little bit with each other, saying how great it was for the two of us to feel like we were back in your classrooms again. So we do have some questions that are popping up in the chat. Rachel and I will ask those of you. And again, to all those in attendance, if you would like to sort of unmute yourself and ask your question, put your video on, feel free to do that as well. But we've got a question here sort of about how you were thinking about vaccination delivery and phases of vaccination for, in particular, college students, which I think is certainly something that we're all thinking about as we do sort of welcome students back to campus. But thinking just, certainly at Grinnell, but also beyond in terms of how we're thinking about getting vaccines to younger people, college students in particular.
Well, I can get us started at least, Eric. I mean, I've been thinking about that a lot this week, future Grinnellians or Grinnellians, however you identify, because, you know, this college has a lot of resources. And so we've been able to stay to the highest level of safety in terms of protecting our students and ourselves. And, you know, then when we decided to go virtual, to do that well, you know, to do that really well. And so all of those things. And part of it was our former president was the head of the National Institute of Health. And so we basically kind of produced a nonprofit out of thin air to get a testing program up here. And so because I have friends around the country who work in higher ed, again, noticing those disparities among different colleges and their ability based on financial circumstances to keep their students safe, right? Is kind of the ground on which these issues around vaccination will now happen, right? And so I've been thinking a lot about that. Like on Friday, we'll have a mass testing of anybody who can get there in Grinnell, so that all of us who belong to the Grinnell community will get tested, and we're constantly kind of improving our approach to testing in Grinnell so that as we reopen, as more of us can interact with each other, we'll do so safely. But it's been hard for me all along. I mean, I read the news 2 or 3 hours a day right now, which is not something that I usually do, to just witness this period in history. And there's been such a silence, as I said before, about children in general. And then I know college students aren't children, but often when we're talking about fairness, the fairness questions seem to start at 25 and go up to death, right? And a little bit of that, of course, is the logic of the disease, and it seems to not transfer as easily among young people, and particularly children. But I wonder now how those existing inequalities, right, about what various schools have been able to do and how safe they've been able to keep their students, what now will happen with the vaccine? Will the vaccine just kind of layer on those inequalities, those already existing inequalities, or not? One thing that many of you may know, but a lot of people have chosen not to go to college this year, but they were primarily people who were going to go to community colleges. So again, we see that deepening inequality between who goes to college and who doesn't. And so I think the vaccines will just be another layer of that, because the sooner we can get safe, the sooner we can kind of go back to the high touch education that characterizes Grinnell. So that's where I would start the conversation from my vantage point. But what are you thinking, Eric?
So I think that, so Kajiro, thanks so much for this question. I think that's, hopefully I got the name right. And you know, this is like a very personal question, right? It's like, I want to be, yeah, I'd love to, it would be great if I was like number one on the list, you know, that'd be fabulous, you know? But here's the reality. Like, the reality is that other people need to be vaccinated way ahead of me. I'm able to like now take a pause here and say, I really, really hope. It sounds like, you know, maybe by August, we're going to be okay. We're all going to be able to start in person. I hope that, or, you know, maybe we'll go just have an online option. One thing I would say is that I'm actually not, say that we only had half the vaccines, right? And we're about to be online for another year. Number one, it would break my heart for you guys, because being on Grinnell together is so awesome. But I can't believe how great Grinnellians have weathered this storm. I mean, my classes have been awesome this year. Last half of fall, I taught a seminar in causal inference techniques in economics, and the papers that my students produced were the best work I've ever seen. So kudos to the Grinnellians who have weathered the storm so far, and I imagine that you guys would weather it just as well. And so to the extent that we can do this online via Zoom, even though there's parts about it that kind of suck, you know what? I think that we should be last in line, you know? And so, yeah, I mean, like, there are a lot of people who deserve to get this vaccine before me. I'm probably not going to get hurt by it, and I've been really careful. And so, yeah, I should have the smallest negative externalities. I should be at the very end of the line, and I'm happy to be there. So I appreciate the question, and I wish I were at the front, but it's just not the case. There's a great question here from Tori, I think is next, and I'll just go ahead and take over a little bit. So Tori, I'll read your question, and you can add on if you want. A question of both of you: how do those who were already underprivileged recover economically and psychologically from COVID when they already lacked resources and accessibility to those limited resources? So thanks, Tori, for this question. I mean, this is just absolutely at the heart of what we're talking about, right? I think you cut to the bone maybe better than both Karla and I did. The first thing I would say is that there's good news. And, you know, part of the good news is the fact that it seems like incomes for a lot of Americans have been really steady during this time, and we're seeing savings go up for a portion of the population, which means that economically recovery is going to happen quickly once it's safe, right? Once people feel comfortable going back, and that's going to be good, right? And that recovery, there's a ton of service sector jobs. I think about, bars and restaurants, right? Those are the places that have been hit really hard, and there's a lot of people who work there. Karla's actually done some really interesting sociological work, specifically at restaurant environments and service sector environments. So maybe she can have more to add in the psychological toll there. But yeah, I think that number one, I think that's great. And number two, it sounds like the Biden administration is really excited about policies like a $15 minimum wage, which actually really helps people who are at the bottom of the income distribution. And who are the people at the bottom of the income distribution? Well, they're literally the people who have been disadvantaged in the past and who are probably being hurt most by this pandemic, right? So this types of policies that help people before COVID at the bottom of the income distribution or in disadvantaged groups are the same policies now, but we need to actually implement them and get serious about them, I think, as a nation. And creating inequality is something that we care about and a goal that we strive toward. So I'll let Karla take on the psychological aspect, which I'm not as good at speaking toward, but this is absolutely a great question.
Yeah, I mean, this is so central to the themes of like reopening and recovering and reaping. And I do share with Eric, I mean, Eric and I hadn't prepped this part, so thanks for the brilliant question. An optimism that the market hit was not as bad as I would have anticipated. Like in April, I would have thought the market hit was worse in terms of overall employment. And so I do think that we're going to recover a little bit sooner than I was worried about. I think that, we've undergone a social experiment that we never anticipated and never would have chosen. And so I do have some optimism that this pause, when combined in this country, at least with a greater visibility on white supremacy and its costs and other kinds of inequality, like we see that when children don't go to school, it slows down the whole economy, but it particularly slows down women's economic activity, for example. There's some opportunity here. And so as Eric said, depending on how effective the policy work is, there really is an opportunity to, when you unpause, right, to make some of these adjustments, as Eric was saying, that have needed to be done for as much as 30 or 50 years in terms of underlying worklessness and declining blue collar employment. So I have some optimism there. I guess the other thing is, like, I don't think we'll really know what the levels of our fatigue are around just how much of our minds and our lives have been spent simply navigating the day, right? Like simply just being a person and keeping your family, whatever that family unit is, safe in unknown ways. I had students that were using their chemical knowledge from chemistry class to make sanitation products to spray off their parents before their parents came home, during this. I mean, so we just have been creative and defensive and, careful in ways that have really used up a lot of us. And as we start to open up, I think we're going to find out that some of us, our reserves have been protected, and we kind of have the reserves, be they financial or emotional or spiritual, to kind of leap into reopening, and for others, not so much. And so, like Eric, I love to think about servers, just because I was a server and I wrote a book about it, but servers get a ton of their energy, not just their money, but their energy, right? From getting to know people and the art of conversation and all of that. Well, most servers had to keep doing their job, right? Like they did it for less money, but they had to keep going if they wanted to keep their work. So will somebody who kept working, who was kind of unsafe, right, over the last 10 months, will they have an easier time reopening, actually, because they didn't undergo a pause, So I think there are so many underlying questions about what reopening looks like, because we've never reopened before. And so it'll be really important. It'll be a great time to be a college student, to be gathering all of these tools, like at a moment when they are so deeply needed to understand, philosophy and humanistic inquiry and psychology, as Eric noted. And let
me just jump in, yeah. Karla, I love one thing that you said, and I want to highlight that. I think one thing too is that, in some sense, seeing this kind of like I said laid bare earlier, but laid bare what the problems were, right? So we have, there's no support in the United States for childcare, right? Basically at the federal level. And so maybe we need more of that, right? And maybe we realize now how important that was. Unfortunately, I don't think we've learned some of the other lessons about like trade-offs between like you have schools open or you can have restaurants and bars open. Which do you want? And so anyways, I hope we learn from that. I think we've got another question here to move on to try to get to the ones that people have posted. And we also have, if you want, you can raise your hand if you know how to do that, and we'll call on you. You can ask a question as well. Here is another one. So it says, hi, deciding who gets the vaccine is based on a lot of data, is what I understand from the articles. How do we know how accurate that data itself is, given there's so much confusion regarding the spread of this disease? I mean, there's so much to say about this, right? Because, one thing that we've just seen over, the last X number of years is an erosion of our sense of trust in data and expertise by a large portion of the population. And so how do we combat this? So I guess number one, how do we trust this data? Well, look, how do you establish trust? Well, I know one thing is that there are people who you do trust, right? And if they represent the data, right, maybe we trust them, right? So at one point in time, the highest approved person in the federal government was Dr. Anthony Fauci, right? Who had a lot of work and success battling the AIDS epidemic before, right? So maybe one way to believe the data is to trust the front man or the front woman or the front person, right? In this case, Anthony Fauci and Dr. Birx, right? Were those people. So that is one thing, but then how do we know the data itself is true, right? It is, data literacy and understanding what places to, what sources to believe in, what sources not to believe in is really challenging. It's really tough, right? And one of the best things I've seen on this, I'm bringing an outside source in, this is a little bit outside of economics too, is that, when you have somebody in your family or in, somebody in your extended network of friends that's saying, that's reporting things that to be false, right? You can ask them, you can say, like, if you believe that, then several different news sources probably checked that and have probably verified that information, right? And so when we see reputable news sources who are middle of the road politically, who are reporting data, right, that are gathered by experts, usually scientists, who are maybe not working in non-governmental jobs, right? That's the type of data that you should maybe trust, right? And if it's the type of data that's being reported by one news source that's politically way deep on either side of the spectrum and is based on a study that's not, done by a reputable academic, then you should maybe be a little bit concerned there. And so, yeah, I think that, I think the data here that these experts on the panel were relying on probably passed the smell test in that it was reported by many different sources and was compiled by experts who didn't necessarily have a political lean. But yeah, I too have been, here's an example of something that's going on right now that I think is really important. And respecting time, I'm a little bit concerned here. I think do we have 5 more minutes or just 1 more minute? Anyways.
Yeah, we have just a couple more minutes, but I would love to take at least 1 more question.
Yeah, we can do that. So sorry, and I'm sorry that I'm talking so much. I should let Karla weigh in on this one too. One thing is that the government lied to us early on. They said masks do not work, right? They knew that masks worked and they said do not use masks. And right now they're actually lying to us again. And they're saying that, hey, once you get vaccinated, you can't change your behaviors at all. You need to engage in the exact same thing. And it's actually, that is not true. You are less likely to get COVID if you have been vaccinated. If you've been shot, then 7 days after, you're 80% less likely to get COVID. And so the idea that you can't change your behavior and you shouldn't change your behavior afterwards is maybe the safest thing to do, but is not realistic, and it eliminates the incentive to actually get the vaccine. And that's the type of information that's going around right now. And so I think that we're right to question the data, and I think that we're right to really, interrogate our sources for sure. Okay, so we've got Karla, and Tori also has her hand up too. So Karla, if you want to focus on that and then maybe engage with Tori on the next question.
No, let's just hear from Tori. I can't add much to that. I do want to say though, Eric was in my sociology of gender class, and this is exactly what he was like when he was 19. And Rachel was in my classes too. So I remember you. So like, but it was like, this was why I really loved having Eric in class, because he had such a fine mind and he was not afraid to be like, but that's not true, professor, like, which you just did about the federal government. So anyway, Tori, let's hear from you.
Perfect. So right now we're living in America with like extreme division. So how do we successfully recover from a pandemic when there's so much division in like the belief of COVID being real and the belief that the vaccine is effective and even like the effectiveness in wearing masks? How do we recover from a pandemic when we're so divided?
Well, I'll get us started and see where Eric wants to take it. Thanks, Tori. I mean, so I'm teaching 2 classes this term that I think they so address this question of division for me, Tori, that like sometimes I can't even remember what class I'm preparing for. And so one's called I, Robot, and it's about technology and our relationships, like kind of that slash between the I and the robot. And then the other one's critical race theory. And for me, those are 2 ways that we have to really investigate the divisiveness. The divisiveness is not just going to be forgotten. I mean, when it comes to the like 400 years of white supremacy, like we, you know, as a nation keep trying to bury what our country was founded on, and that this is very central to the American project. And so now we have an opportunity to really investigate, like I think it was Eric that said laid bare, right, Eric? And like, that's how I feel about the pandemic, that it's horrible how much it's been revelatory about inequalities. But when we have a liberal arts imagination, we really have, there are some openings here too, to really take seriously what that divisiveness comes from. So for me, the divisiveness does come, new levels of divisiveness are made possible by what Eric was talking about, that we live in niche environments. So we get different stories about reality because of technology and because we don't have shared information with one another. And so that has really been exposed, right, deeply and dangerously. And so there's ways to teach people skills for you know, evaluating different ways of knowing and different sources of information. And that's why I'm really of the belief that a liberal arts education is much more powerful now than at other times in history, because it allows us to kind of navigate like ways of knowing and ways of understanding division, be they like spiritual, be them cultural, be they about resources. So so I think, yeah, I mean, I think we're incredibly divisive. I think we have to get honest and serious about how divided this country is, how fragile it remains. Even though we passed through a moment where it felt like it was going to maybe explode on January 6th, we are still an incredibly fragile nation and at one of the most fragile moments. But there's a lot of opportunity amidst it. And I don't say that in like a Pollyanna-ish way. I just say, as Eric did, like when this stuff is laid bare, there's opportunity to act upon it as well. And maybe some shared will, because I think this year has had so much suffering in it that for a lot of us in many of the pockets that we live in, we really are ready now to imagine new and better worlds. What would you say, Eric?
This is the toughest question that there is. I think this is the $1 million question, right? I don't know. I don't know how to recover. And honestly, a liberal arts degree is great for many different reasons, but it hasn't helped me convince anybody with very different beliefs from myself or find middle ground with them. And it's really a frustrating thing. Yeah, I mean, you know, like I think that the more that we reach out and the more that we try, though, the better success we're going to have. Because I'll tell you what, if we're not reaching out to people with different views than us, and we're not talking to people with different views than us, reading people with different views than us, trying to understand different perspectives, we're going to have zero success. So maybe that's where to start. It looks like we got one more question in the chat here. This is from Helbo. And he says, "Dear Professor Eric, I think that rewarding or giving money to those who are willing to accept the vaccine makes sense." I'm so glad that you agree with me. But if the policy will deepen the bias or misunderstanding from those who believe the vaccine is just a conspiracy, that might be a problem, I think. Therefore, there will not be economic benefits since only people who trust the vaccine will inoculate. And so the key here is that people who do not trust the vaccine are going to be like, I would take that money, right? Even if, you know, my buddy got the vaccine, I don't think it's doing anything. I don't believe in COVID, but I want that money my friend, she or he didn't get hurt when they were vaccinated. And so boom, I'm going to get it too. I'm going to take that money, right? And so the money really is supposed to solve the problem. Now, do we need to solve the problem that people believe COVID exists and that the vaccine actually works? Yes, that's probably a good thing to think about. And you're absolutely right that paying people does not fix that problem, right? Convincing them to get the vaccine because they're seeing people not get sick who've had the vaccine, like that's probably more important. And so how about if you have figured out a really nice problem with my theory to just pay people for sure.
So I wanted to just wrap up here to be mindful of the time of both Professors Erickson and Ohrn and all of your time. It is evening or perhaps morning where you are. So thank you very much for spending some time this evening with Grinnell. Thank you very much to Karla and to Eric. You now know the names and faces and thoughts of some of our most wonderful faculty, but I think that this is sort of very much the experience that you can expect when you are students here, right? Really good conversation, really good thoughts, and really respectful questions from people who come at ideas from very different points of understanding, but it's so productive. So thank you again to Karla and to Eric and to all of you. We look forward to holding more of these sessions in the future over the course of the spring so you can continue to get to know our faculty and to learn and hear from them. So thank you again, everybody. Have a wonderful evening or perhaps day if you're just getting started.